It's another day with the physicians where your health is our business.
It's growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what you know is
You're welcome back to the training also on your regular program. Malaria and typhoid are two leading diseases of major public health importance and cause of morbidity and mortality, affecting humanity, especially in sub-Saharan Africa. It is estimated that malaria is responsible for 2 to 3 million deaths and 300 to 500 million infections annually. Severally, people have been misdiagnosed and have taken up to self-medication whenever they come across symptoms that are like these diseases. Our expert on today's episode will be talking to us about acute malaria and chronic typhoid, the fallacy of misdiagnosis and self-medication. It's another day with the physicians where your health is our business. Where else can you get the best if not on your regular health TV talk show, The Physicians, where we always care about your health. My name is Dr. Martina Agberie, and I'm not alone on this program. I have with me
Memuna Yusuf Kadri. You're welcome on board.
We're talking about acute malaria, chronic typhoid, and of course, the fallacy of misdiagnosis and self-medication. I'm particularly very excited about this topic because there is no day a patient will come to me telling me, "Doctor, I have malaria and I also have typhoid." And I ask, "How did you know
You have malaria and typhoid?
Yes, did you do any medicine?" "No, last night I had so many mosquito bites and I think I have malaria." Have you actually experienced it?
No, it's a normal thing. It's not experience. It's something that everybody, as far as you are in sub-Saharan Africa, or let's bring it down home, Nigeria, you find that everybody is in quotes, a doctor when it comes to malaria and typhoid.
Misdiagnosis and self-medication accounts for the number that we say about 2 to 3 million
people that
deaths
die annually.
Yeah. Then about 300 to 500 million people. Okay?
So the thing is,
come down with infection.
Yeah. The thing is, when people just keep treating malaria and typhoid, it takes away the focus on what truly may be going on. So you treat malaria, you don't feel better, you think it is typhoid without even
doing any investigation
and all that. Because even doctors have now been educated and updated that test that they used to do before is not the regular test that they're using for typhoid right now, and all that. Even the WHO will say, look, do tests before you start saying you have malaria and all that.
But these days people don't do that. They just say the symptoms are the same. I'm very used to. I know when I have malaria.
In fact, they'll be telling you, doctor, are you telling me I don't know that I have malaria? Doctor, I have malaria. I say, okay, now that you told me you have malaria, what should I tell you? Because I'm the ones that are supposed to make the diagnosis. You are supposed to tell me the symptoms. Now, okay, now you have malaria, treat yourself now. It's not like that now, but it's just that I know myself. Anytime I feel like this,
some will tell you when my eyeballs are beginning to ache, when I start to have palpitations,
yes,
my heart is racing, body pain is malaria.
It's malaria, it's nothing else. Meanwhile, they are just stressed. Maybe for one thing or the other, you just assume.
The one that is the most annoying is when they come and tell you, I need to take treatment for malaria and typhoid. Because if I do not treat the typhoid, the malaria will not go.
I I don't get it. Like, who said malaria and typhoid must go, you know, like brother and sister?
Well, let's know. We have an expert, as usual, a public health physician that is actually going to come and do justice to this topic. Don't go. We'll be back after this short break. Just stay tuned. Welcome to your regular program, The Physicians, where your health is our business. Today we're talking about acute malaria and chronic typhoid, the fallacy of misdiagnosis and self-medication. We have in the studio a renowned public health physician. He is also a senior lecturer at the College of Medicine, University of Lagos. We have Dr. ALERO ROBERTS. Welcome to our program.
Thank you very much for having me.
Nice having you again.
Welcome, Dr. Roberts.
Thank
Always
you, Dr.
a pleasure
Lemuna.
having you here.
Thank you so much.
So now we'll be talking about acute malaria and chronic typhoid, the fallacy of misdiagnosis. Let's take misdiagnosis. And of course, we heard in our introduction, we talked about 300 to 500 million people come down with the infection annually, and about 2 to 3 million deaths annually. Why is this so common in Sub-Saharan
Of which
Africa?
94% occur in Sub-Saharan Africa.
And Nigeria is part of Sub-Saharan Africa.
Nigeria is part of Sub-Saharan. In fact, Nigeria accounts for 23% of the global cases.
Is there any
It
reason why we
tops-
have this?
Very many reasons. And you know, my favorite area of my favorite topic comes back to primary education and primary health care. So in areas where you have poor sanitation, poor personal hygiene, poor health literacy on what to do and how to prevent oneself from getting these illnesses. You know, I hate to say it, but these can almost be considered diseases of poverty. You know, so, and that's why we get so many cases, and we still have so many cases despite the fact that both these diseases are preventable and treatable.
So, but is there a link between malaria and typhoid?
The fact that they are both prevalent in places where there's poor sanitation, but technically or clinically, no. Clinically, yes, technically, no. So let me explain. Malaria is caused by a parasite carried by the mosquito, the female Anopheles mosquito. So hence that your story. Mosquito bit me last night, I have malaria today. Not quite true, but the link is there. You have to be bitten by a mosquito that is carrying the malaria parasite.
The female Anopheles.
The female Anopheles mosquito that's carrying the parasite before you can get malaria. Within about 10 to 15 days of being bitten, 10 to 15 days, that was that incubation period you are talking about, you could probably get malaria. Whereas typhoid is caused by a bacterium, the Salmonella typhi, which is related to the same bacterium that causes food poisoning. Okay, but the typhoid fever is a slightly more horrible disease and can eventually be fatal if it is not treated properly. Whereas the Salmonella food poisoning, because is a self-limiting disease that usually goes within, comes on within about 12 to 24 hours of eating the infected food, the poisoned food, and self-limits. But typhoid fever, not so. That one needs to be treated, and sometimes even needs hospitalization to be treated properly.
So what are the usual manifestations, the symptoms?
That is where clinically they now become linked, because there's what we call overlapping signs and symptoms.
Okay, of typhoid?
Of typhoid and malaria. Okay. Both present with fevers. Okay, the fevers are different, but that difference can really only be picked up by trained clinicians. So they both present with fevers, they both cause you to get headaches, they both cause you body aches and pains. They may or may not give you, typhoid is more likely to give you diarrhea and then vomiting. Malaria less so, but there are some people who simply because they are ill start vomiting, particularly in children. You know, and then, you know, you have all the other symptoms of general unwellness, apathy, sleepiness, irritation, loss of appetite. So when you think of it, really, there's no difference between, because like I was saying earlier, your head is hurting, your head is hurting. It could be dehydration, it could be stress, you are thinking too many things, it could be the landlord knocking on your door, it could be as serious as brain cancer, a headache, it could be COVID. Also presents with very, very similar overlapping signs and symptoms, and that one is a viral disease.
Exactly.
So we've got parasite, bacteria, and viral. Headache, major headaches. And so, and once you've got a headache, you've got a headache. Again, it takes careful clinical examination to be able to tell the difference between the two. And even then, clinicians are smart enough not to rely just on clinical acumen. They will do a physical examination, they will carry out their laboratory tests.
So now we have a parasitic infection, we have a bacterial infection, but that fallacy that if you have malaria is almost as automatic as if you have typhoid. Well, is this a myth?
It's not a myth. It is not a myth, and I'm very glad you brought that up, because again, like I'm saying, these are what we call diseases of poverty, poor sanitation. So let's paint the scenario. You've got the family living in a face me, I face you, you know, poor ventilated home. They are sharing bathroom and toilet facilities. They're sharing kitchen facilities. The water is coming from a shallow well. Okay, and there's no running water per se. And you've got family of 5, 6, 7 all living in one room. Where are you going to spread with refuse dump?
By the side.
By the side. Where are you going to spread an insecticide treated net?
There's no place safe.
Thank you very much.
Most of them are even sleeping
What
outside.
is the water supply that is coming? So that every time they go to the toilet, are they washing their hands for 10 to 20 seconds with soap and run? Thank you very much. Are you getting the picture? So in that kind of place, the mosquitoes that are biting the children are infected with the parasite. The water that they are using, whether to drink, whether to cook food, whether to wash plates and knives, is contaminated with feces. You can have a co-infection.
Yeah, which is common.
Yes. You know, and then you've got a place where you are thinking in terms of, now let's go a little bit further into your favorite topic, nutrition. The nutritional status is comme ci, comme ça. So they're exceptionally prone to infection anyway.
Immunity is down.
Immunity is low. You understand what I'm saying? So she gets you get a malaria, you could get a typhoid at the same time.
Okay, before we talk about the treatment, okay, let's talk about the diagnosis. How are you able to diagnose the difference between typhoid and malaria?
That is where we come to. So let's start with number 1, access to medical care. Because you see, when you're making a diagnosis, who is the patient going to for that diagnosis to be made? You know, is the patient, are they looking at their favorite neighborhood, somebody who is some, health worker of dubious? Are they going to a properly accredited hospital? Where are they going? That's the first thing. And we have to keep remembering that in our environment, people's choice of where to access care is based on their pockets. Where can their pockets carry them to?
Because most people is out of pocket
It's out of pocket payment.
It's wrong.
Well, this is the situation that we face. So they first do what we call diagnosis shopping. They start with what they can afford, home treatment. Somebody in the neighborhood says, yes, when my child had this or when I had this and this is the way I felt, I know what it is, it's malaria, take this. That's their first port of call. It doesn't go, they then get to a chemist. It doesn't go, they then get to the first private hospital. because everybody knows that the PHCs may or may not be manned, especially if the disease, the illness is happening in the evening or at night. Yeah. These are the real life scenarios that people face. Where do I go? So depending on where you end up, now let us assume that in an ideal situation, they go to a properly accredited hospital and they meet a properly trained physician who then takes the full history. By that time, the physician is able to tell which way he's going or she's going. Sure. Okay? Does the physical examination, because like we were saying, the case we were talking about presented with abdominal pain. Now, is this abdominal pain of enteric typhoid fever? Is this the abdominal pain of tender hepatosplenomegaly? That takes a physician to be able to make that difference. You understand? After which the physician wisely sends for tests. Blood, stool, possibly urine. Do you understand? At that time, the physician is beginning to now differentiate between the two. And if it's a co-infection, is well able to manage. But this is assuming that the patient got to an accredited place, because we are assuming that at the onset of the illness, let's even take worst case scenario, it is a co-infection, the head is aching, the body is aching, the person is feeling unwell, has loss of appetite. Okay, but the person is still in what we call the first third of the disease process, easily reversible, easily treated, easily curable. But no real, it's when the diseases start getting into the severe stage that you have this divergence of symptomatology. But by that time, we are getting too late. We want to be able to treat it in the generalized, when there's generalized body aches and pains, generalized, the head is just aching, the fever,
Dr. ALERO, just hold it there. There are so many more accurate ways of finding out if you have active infection. We'll be back after this short break. Just stay tuned.
More than 2 times.
I only have malaria, but it's just once this year.
Yes, I've had malaria twice in this year.
I went to a chemist, so they test me and they told me it was a malaria.
My mouth is bitter, I have a bit temperature, and I'm not able to eat.
No
at all. I did not, but I know it's the symptoms of malaria.
I get my treatment at the chemist, so they prescribed a drug for me for malaria. Then I went to go and buy the drugs.
From pharmacy, I bought a drug and used it, and I'm okay.
From this normal pharmacy, I will just go there and explain to them that this is what is happening, so they will give me drugs. It's very hard. It's very hard. It can kill, but it's very hard for you to hear that malaria kills someone.
I'm not sure, because I've never seen the person malaria or typhoid killed.
No. Malaria does not kill, but typhoid kills.
If you are just joining us, you are on to a regular program, The Physicians, where your health is our business. We've been talking about acute malaria and chronic typhoid, the fallacy of misdiagnosis, and of course, self-medication. In our studio, we have the beautiful guest. She is very, very intelligent, Dr. ALERO ROBERTS. She is a consultant public health physician with the Lagos University Teaching Hospital. She's been telling us so much about typhoid and malaria, how endemic it is. And she did mention the different ways of knowing if you actually have infections of typhoid or malaria. I was right before we went on break. So let's go back to that. What are the different ways of knowing that the person actually has this infection?
The most important thing that I think everybody should know is that, number one, know where you are going. Make sure you're getting to an accredited health facility with properly trained healthcare workers, particularly a physician who can actually take you through. Because again, the tests that would be recommended would be based on the clinical presentation.
Yeah, you're right.
So you can't sit down here and make a blanket statement for it, because everybody may present ever so slightly differently, and of course it also depends on the age of presentation. You know, what we're going to do with children may not be what we'll do with adult males or pregnant females and things like that. So you've got to, I think the most important thing is that when you're considering how deep your pockets are, also consider value for money.
Very important.
You must consider that cost effectiveness. What are you getting for your, because you know, we've had so many stories of people who end up spending far more than they needed to or should have spent, because in the first place they went to the wrong place.
Also, let's look at this two-pronged question. Causes of malaria and typhoid and risk factors. Who are those more at risk?
So the first thing we said, those more at risk for typhoid are those who are living in poor sanitary conditions and therefore have poor personal hygiene. Particularly, what are we going back to? Hand washing.
I think we actually lost it somewhere.
Oh, we did.
Growing up, we always had us back that. Growing up, we always had wash hands regularly. Yes. And somehow we just lost it.
We just lost it, you know. So hand washing is vitally important. Mothers who are looking after children, and you know, do they remember to wash their hands every time they change the child's diapers or wash the child's bum after a poo? You know, little things that just, and the problem with typhoid particularly is that you can be careful 99.9% of the time. And it will be that 0.1% of the time that you were careless
that you have the infection,
that you now infected the food your family is going to eat.
Just from fruits, even from the
buka. Food, yes. Where do you eat? Where do you say? Are you one of those mothers who, you know, find it more convenient to give the child a bowl and a little bit of money to go to Yabuka down the road to buy food? You know, when the children take food to school, or the food the children are even eating in school, which was why, you know, we had to have such a strong food vendors program, all broken down, because these are systems that need. Now we're seeing, what else are we seeing? Then shall we introduce yet another topic?
Cholera.
Yes, the
outbreak, because even the feeding, the food, the duration they bring the food to the time the child eats
Thank
the food.
You very much.
It's very important.
Poor sanitation, poor personal hygiene, poor hand washing practices. That's typhoid right there. Then you have poor environmental hygiene. That's malaria right there. So you can imagine if you're living in a place with poor sanitation, like as not, there's poor environmental hygiene. You know, and uncleared bushes and receptacles with stagnant water and so on and so forth going on there. So the people most at risk of severe illness, the very young, the very old, and the pregnant.
Because of their immune status.
Because of their immune status.
Time is always not our friend here. But I don't think I want to let you go without saying one or two things about the complications. Severe.
And that's the problem. Ultimately death. I mean, perforation of the intestines
from typhoid.
From typhoid, and that is one of the biggest things, that because remember, if you had to do house officer and you were ever in accident and emergency, acute abdomen. Oh, that was a nightmare, and you don't know, it could be anything from a ruptured appendix, a perforated typhoid, ectopic pregnancy. Oh, all you knew was that time was not your friend. And invariably at that time you could not get a full history.
Okay, time is not always our friend, not even with typhoid, no, malaria. So always try and seek medical attention, see a doctor. Don't go telling the doctor that you have malaria and typhoid and they should just give you medication. The doctor needs to actually listen to you, do what we call clacking, take history, proper history. Take blood for investigations, and a diagnosis is made based on that. Don't just go to any lab by your house to go and do a typhoid test and you come see the doctor with the reports and say they said I have typhoid. No, only one result is not sufficient in making that diagnosis. Again, thank you so much for staying with us and being our regular audience listening to us on your program, The Physicians, where your health is our business. I remain Dr. Martina Agbere.
And of course, you do also remember that malaria and typhoid are two different diseases, and it's in sub-Saharan Africa, like Nigeria, it is high. So please do yourself a favor. If you ever have fever, don't just assume it's malaria. Time is not on your side when it comes to any medical condition. Accredited center, right physician, take the right medication. That is exactly what you need. Don't forget to follow us on all our various social media platforms. And if you want to be part of the show, you are just a click away. Till next time, remain blessed. My name remains Dr. Memuna Yusuf Kadri.
Hello everyone, I'm Professor Bamigoye, a researcher from Johannesburg, as well as Abuad in Ado-Ekiti. I implore everyone here to keep watching the physician as more is about to come.
If there is irregularity that disturbs that sequence, it's going to cause a problem. That irregularity can come from the upper chamber or it can come from the lower chamber. For example, a condition called atrial fibrillation, where this upper chamber is just quivering, is going to